All right, let's talk about something that drives us all a little crazy. Medical news. One day you read that something's a miracle cure, the next day it's terrible for you. It's totally confusing.
I mean, you've seen these headlines, right? They're everywhere, and it could be just incredibly frustrating. But what if I told you there's a system that doctors and scientists use to cut through all that noise? Well, there is, and we're going to walk through it right now.
So here's the game plan. We'll start with why we're all so confused in the first place. Then we'll get into the secret weapon, the evidence hierarchy. We'll rank the research from weakest to strongest, see how that becomes real-world medical advice, and finally, figure out what it all means for you.
Okay, so how do we actually bring some order to all this medical chaos? Well, the solution is a concept called evidence-based medicine, or EBM for short. It's not about finding one single perfect study. No, it's a whole process for looking at all the information out there to make the best possible decisions.
You know, EBM is actually this whole 5-step process that medical pros use. But for us today, we are going to zero in on step number 3, appraise the evidence. And why that one? Simple, because, and this is probably the biggest takeaway today, not all evidence is created equal. Not even close.
And that brings us to the main event, the evidence hierarchy. The easiest way to think about it is like a pyramid, or maybe a ladder. Down at the bottom, you've got the weakest, most shaky evidence. And way up at the top, that's the solid, trustworthy, gold standard stuff. So let's start climbing that ladder. We're going to begin right at the very bottom on the lowest rung, which is level 5 evidence. Level 5 is where a lot of headlines come from. It's basically one person's experience. You know, an expert says something, or there's a story about one patient who tried a new treatment and it worked wonders. It's a great starting point for an idea, a little spark for future research, but it's just a story. It's not data you can bank on. Okay, one step up the ladder, we hit level 4. This is a case series. It's a little better because now we're looking at a small group of patients, not just one. But there's a huge piece missing here, a control group. We see that 10 people got a new surgery and felt better, but we don't know if they did any better than people who got the old surgery or no surgery at all. There's no comparison. All right, now we're getting into much more powerful stuff. Levels 3 and 2 are a big deal, because for the first time, we're actually comparing groups of people. And that comparison is absolutely essential if you want to figure out what's really going on. Now, the difference between these two levels really just comes down to time. A level 3 study is retrospective. It looks backward. It's like being a detective trying to solve a cold case by digging through old files. But a level 2 study is prospective. It's way stronger. You start today and you follow people forward in time. This is so much better because you're collecting the info fresh, which means there's a much lower chance for bias and errors. And here we are, at the very top of the pyramid for a single study. This is the randomized controlled trial, the famous RCT. The secret sauce here is that word randomized. Researchers assign people to different groups completely by chance, kind of like a coin flip. Why? Because that's the best way to make sure the groups are similar, so you can be really confident that any difference you see at the end is actually because of the treatment and not some other factor. So we've climbed this whole ladder, but what's the point? Why does it matter? Well, this isn't just some academic exercise. This hierarchy is exactly what professional medical groups use to create the guidelines that your doctor relies on. Check this out. This is a real-world example from the American Academy of Orthopedic Surgeons. They literally grade their recommendations based on the evidence. To get a strong recommendation, you need at least 2 high-quality studies. That's a really high bar. A moderate one can come from just one top-tier study. And see that one at the bottom, consensus? That's basically just expert opinion, and it's what they use when there aren't any good studies to look at. And this brings us to the most practical part of all this. What does it actually mean for you when your doctor talks about a treatment having strong versus moderate evidence?
Let's really break this down. When you hear strong recommendation, that means the medical world has a super high level of confidence. We're talking multiple, high-quality studies all pointing to the same conclusion. It's solid. Now, a moderate recommendation doesn't mean the evidence is bad. It just means there's less of it. Maybe there's one really great study, but doctors would love to see a few more to be absolutely sure. The evidence is good, just not as deep yet.
So you've now got a toolkit for thinking about this stuff. The next time you see a health story, remember, not all studies are the same. Be a little skeptical of anything based only on an expert's opinion. And remember that when you hear strong evidence, that means something very specific.
It's a recommendation built on a solid foundation of top-tier research. Science isn't about one single study. It's about building that foundation over time. So now, when that next miracle cure headline pops up, you'll know what to do. Instead of just believing it or dismissing it, you can ask the right questions. What level of evidence is this? Is it just one person's story, or is it a major clinical trial? And that, right there, is how you start to decode the news for yourself. Thanks for tuning into this explainer.